Hi, Nurse Corey here. And today I wanted to talk a little bit about residential treatment centers. So, in comparison to a psych hospital, which is a short-term solution for someone suffering from psych issues, a residential treatment center is more of a long-term option. And you can have a short-term residential treatment center or a long-term residential treatment center. A short-term could last anywhere from 3 weeks to a couple of months. And a long-term residential treatment center could be anywhere from 8 months, 12 months, sometimes longer than that. The purpose of an RTC is to, provide ongoing treatment to someone with psychiatric issues. There are many benefits to RTC. So, for example, they typically have a home psychiatrist, and the benefit of that is the psychiatrists are better able to monitor an individual on an ongoing basis to really see how the medication is affecting them, to really get a good idea of what kind of conditions we need to treat, and come up with a treatment plan from there. So another benefit of residential treatment centers is that they have group therapies. They're often live-in. Actually, they are live-in. My son is currently in an RTC, and it's considered a psychiatric RTC. So with that, my kid lives there, and he sees a psychiatrist there on a weekly basis who manages his medications. He also goes to school there, so it functions somewhat like a therapeutic boarding school, which is also another type of RTC. However, psychiatric RTC is a bit more well-rounded. You can also have military schools that are considered RTCs, therapeutic boarding school, as I said, and then eating disorder RTCs. There are lots of different options. Again, it's really for someone who has not responded to treatment in the past, short term, whether it's the hospital setting or it's an outpatient setting. They're really meant to provide long-term treatment to someone who has been resistant to treatment before. So the benefit of the RTC that my son is currently at is, as I mentioned, the psychiatrist is there. We also have a counselor who's there that does one-on-one counseling with my son, as well as family counseling. I don't know that all RTCs offer that, but the one that my son is at does, and I think it's wonderful. And if an RTC you're looking at doesn't offer family counseling, I suggest looking for one that does. Another benefit of an RTC is that they go to group therapy a couple of times a week, and they're living with others who are suffering from the same conditions as they are. And with that, there are some concerns, of course, that your child will be exposed to certain behaviors that they wouldn't otherwise come across. And sure, that I've definitely been concerned about that many times. But the other benefit is that they see people struggling with the same conditions that they are, with the same issues that they face, and they see them overcome that and get better over time. I hope that helps. If you're looking at different RTCs, I suggest you find one, as I said, that offers family counseling. The one that my son is currently at also offers parental groups and counseling. So we have, once a week parent therapy sessions. It's in a group setting, and then we have DBT therapy right after that. So, other RTCs that I've been to, the short-term ones that we've been to, they don't really have too many parental options. One of them did have, a parent support group, but it was more of a commiseration. And I don't know about you, but personally, I'm not looking to come together and complain about my problems. I want to find solutions for the things that we're facing, because I realize that I have a part to play in what's, in the struggles that my son has had, and I also want to be better. So I hope that helps. RTCs, they can be of great benefit. Do a little bit of research. Might help to ask around. You could also find so RTCs, I hope that helps. I hope that gives you a little bit of insight as to what you might be facing if you have to go to one, or if your child has to go to one. And thank you for watching.